Welcome everyone, and thank you for coming. As this is continues to be a very dynamic situation, we think it's important to keep you up to date on everything that's happening at the Mohawk Valley Health System. So today we're going to talk quickly about 4 things. First is our surge plan. Secondly, we're going to talk about the temporary closure of some services. Third, our community has been asking how they can help, and we want to give them some ways they can help us. And fourth, we're going to demonstrate for you donning and doffing, which I know is a new concept for all of us to be thinking about, but a real important part of the protection of our employees. So yesterday, hospital leaders had a conference call with Governor Cuomo and the Commissioner of Health, Zucker. It was a very sobering conversation. The number of positive COVID-19 patients doubles in New York almost every 3 days. It is projected that those that are infected, that 15% will need hospitalization, and of those that are hospitalized, 1/3 or about 5% of those infected will need ICU care. So the math behind this, as projected by leading consultants that the state of New York is working with, indicates that New York will require, at the apex or the peak of this pandemic, up to 140,000 hospital beds. The state currently has 53,000 staff beds. So I think, as you know, last Friday we were told to develop a surge plan to increase the available beds in our community by at least 50%, no less than 50%, and as much as 100%. Our surge plan, as delivered yesterday, does include a 100% increase in the number of patients on an inpatient basis we normally take care of at the St. Luke's campus where we're standing today, and a 75% increase at St. E's. For St. Luke's, we usually staff 173 beds, and that can surge to 346. And at St. Elizabeth's, 141 to 240. We also have the capability of taking care of 25 vented patients for a total of 50, 25 at each campus for a total of 50. As you probably have been hearing, the supply of vents is a crisis point with taking care of these positive ICU patients. Our plan provides for the ramp up over 9 weeks to those levels. The state had asked us for 12 weeks, but we figure we can do it in 9 weeks. If we have to respond more quickly, we will be ready to respond. We have already ordered, I think, 270 beds, working with the Mohawk Valley Hospital Supply Company to expedite the delivery of these beds. We are taking rooms that have been mothballed for years or used for offices to transition them into patient rooms. The state has relaxed all of its regulations so that hospitals can do what they need to do to be able to meet this surge. So we are planning for the worst case scenario. I think we're all hoping that it doesn't get to this stage, but we have no opportunity to not do this. We are doing our part and are really pleased with the rapid response of our staff to be able to increase our capacity. The surge is expected in 14 to 21 days in the state. We don't know when that surge will actually get here, but we do understand that it is the expectation of the state that all of the state's hospitals are part of the answer. That means we will very likely have patients sent to our hospitals from other communities when they have run out of beds. Also, to comply with the governor's wishes, dictates, mandates, we have kept all non-essential staff from the organization either working at home or out on PTO. And we are also closing some non-essential services. We have eliminated things like routine screening mammographies, but certainly we would do diagnostic mammography. Pulmonary rehab and sleep services have also been eliminated. Rehab and cardiac rehab have been stopped on site, but certain patients are getting rehab advice and direction over the telephone from their physicians. All lab radiology and ultrasounds must be essential. Life-saving procedures that must continue on an outpatient basis are dialysis, radiation oncology, infusion, and chemotherapy. We will not be doing any low acuity non-essential surgeries. We will be doing surgeries that support our goals of saving lives, saving limbs, or improving health. If there is a debate about that, Dr. Kent Hall, our Chief Physician Executive, and Dr. Eric Yas will be working with other physician leaders to do the right thing for our patients while also doing our part to decrease the risk and the spread of this disease. Keeping people safe is a priority for us. We are getting many calls from our community wondering how they can help us, and there is something that our community can do. They can make masks. We are getting short, like every hospital in the state, we're getting short on surgical masks. You can go to our website and it will give you directions on the style and what fabrics to use to make masks. Our website is mvhealthsystem.org. mvhealthsystem.org, that's one word. Over the last few weeks, donning and doffing has become a part of the language of the public. For us, it is more than just the part of our language. It is what keeps our employees and all the doctors and nurses at the front line in particular safe. So today we have Alita, who is an infection preventionist with us, who is going to be showing you how important donning and doffing is, and she'll be going through the specific steps. Each step is really important to eliminate the potential risk of the spread of this virus. So with that, Alita, if you would show us how to don and doff.
Okay. The first thing is, it's very important, is for hand hygiene. You'll either find one of these portable ones, or they're on the walls outside the patient rooms, and it's important to do 20 seconds of hand hygiene. So, and it's pretty wet, so you just do it until it gets dry. And get in between your fingers and your wrists. Then everything is outside the patient's room that we need. So these are disposable gowns. And prior to putting on any PPE, personal protective equipment, is to make sure everything is intact. There are no holes where there shouldn't be. So this looks great. Over your head. What I love about these gowns is that we have these finger holes, and that helps protect our wrists, which is very important for germs. And then the way these gowns, you don't have to tie them in the back, because that's covered there, but you do have to tie this appropriately. Some people just tie it back here, which I like to do, or you can bring it out through the front. Either way is fine. The purpose is just to cover your body. Then the next thing is these surgical masks or ear loop masks. So I put them around my ears. It's important, especially I wear glasses, to pinch it under my nose. So make sure my nose is covered and my chin's covered. That's very important to keep it in place once you have there. Okay. Then I have my face shield. And these are made by our engineering department, which is wonderful. So bear with me on this one. And the purpose of this shield is to protect my mask, right? From any droplets that come in. Then I'll have my gloves. Again, because it has that thumb hole, it protects my wrist. I don't have any exposed skin. And if I ever have any questions, I can have a spotter that's available to help me spot. And now I'm ready to take care of my patient. And I can go in. Okay? So to take this off, I will, because it's disposable, pop, pop, hold it away from me, rolling it from the inside. And I'm going to put it in a closed container. I don't have one for this demonstration purposes. I do not want to push that down because that could aerosolize any droplets, and which I don't want to do. Then I will perform hand hygiene. Again, just in case I contaminated myself, it's always very important to do that. And then to take off my face shield, I will lean forward, take this off. Again, touch that. I'm a bit of a hand hygiene. I will do it again. Some people don't have to if you feel like you did not contaminate yourself. Now this is the important part with our masks. Because the masks are made, the droplets will be here. I want to make sure I grab it from the ear loops, because if I touch it from the front, I will contaminate my fingers, and I will dump it in the bag, in the receptacle, hand hygiene again. It is a multi-step process, but it protects us and it keeps us safe so we can continue providing care for the rest of our patients.
Just to put this into perspective, we have counted that the number of interactions for a patient in a room on a daily basis is 24. There are 24 times a day that someone will go in and out of a room, and each time they do this, each time they go in and out, they have to go through this process. It is a life-saving process. It seems simple, but it is something that's drilled into people. We have training stations in our organization, and we keep track of everybody who has been through the process. I have been through the process and have my little note that I passed. So it's very important, and it is life-saving, and our staff knows how to do it. It's really important. Our medical group has also consolidated several of its locations into, I think, 7 different locations. So we are encouraging people, if they need to see their doc or want an appointment, to call ahead. Just don't show up. We also are making great progress on telemedicine, and we think within a couple of days we will be sending out directions for telemedicine to keep patients in contact with their physicians.